Good afternoon. I am League Member and Voter Services Co-Chair Diane D'Imperio and will be the moderator for County Commission District 3 panel. There are 3 Democratic candidates for the County Commission District 3 seat who will appear on the primary ballot. The candidates are Anna Precia, Jason Stanford, and Kevin Thorpe. Welcome, candidates, and thank you for joining us today. Alachua County Commissioners are elected for a 4-year term with no term limit. Seats are elected by the county at large, and all registered voters in Alachua County, regardless of their place of residence, may cast a vote in all county commission races. At the time of the election, candidates must live in the district for which they would represent. The format of this panel is as follows. Each candidate will have 1 minute for an opening statement. Following the opening statement, I will read questions prepared by the League, and each candidate will have 1.5 minutes to answer. There will be a total of 4 questions, and we'll rotate the order in which the candidates respond. Candidates will be able to see the timer, who will indicate when you're with your questions that you'll have 30 seconds to go, and then you'll be told when to stop. And as we've said before, if you don't stop, we may have to mute your microphone. So your 1 minute opening statement will only give you a stop sign. Now begin with the candidate's opening statement. Each of you will have 1 minute, and we'll begin in alphabetical order with Anna Precia.
Thank you, and thank you to the League of Women Voters for organizing this great forum. My name is Anna Precia, and I'm running for Alachua County Commission District 3. My educational training and my early career were focused around ecology and conservation, in particular habitat protection and drinking water protection. And I have over 20 years of experience working on issues of sustainability, natural resources, social justice, and economic opportunity and business development. And these are the issues that I find most important. From working on our county water management district with our county and our water management district, to building and leading the first Office of Sustainability at the University of Florida, I have learned to navigate bureaucracy and large institutions to implement policy and make effective changes that benefit people's daily lives. In co-founding and leading the local nonprofit Working Food, I've been on the front lines of collaborating and advocating for our community on education, healthy food access, and economic opportunity. My experience working in these complex institutions has prepared me for this job, and I'm a creative problem solver that believes deeply in community engagement and collaboration. Thank you.
Jason Stanford, your statement, please.
All right, good afternoon. Thank you so much to the League of Women Voters for having this. Again, my name is Jason Stanford. I was born and raised and educated here in Alachua County. I said earlier, I went to Hawthorne High School, proud graduate of there. After I graduated from University of Florida, I moved to Atlanta to begin my public health career. And I went to graduate school at the same time. I have over 20 years of public service experience, specifically in public health, or primarily in public health at the local, state, and federal level. Most of my experience has been providing grants and technical assistance and guidance to community healthcare centers that provided healthcare and access to care for people that were uninsured. As a state project officer, I worked for about 4 or 5 years providing guidance to county governments on how to better apply for grants at the state level. My project officer in Washington called me to come up to work in Washington, and I began as a national project officer in the Department of Health and Human Services. Under the Obama administration, I got to work on the Affordable Care Act at the CDC, and I'm happy to bring that experience to Gainesville and Alachua County. Thank you.
Thank you. Kevin Thorpe, your statement, please.
Thank you all so much for having us today. Just before COVID-19 struck Alachua County and before the murder of George Floyd in Minneapolis, Minnesota, the 2 most important issues for us were ending the educational achievement gap and finally putting an end to the economic and wealth gap. As we navigate through these difficult seasons, we're going to need someone on the commission level who is uniquely qualified to help us through them. I believe that I am the most uniquely qualified candidate in this District 3 race. We have three major opportunities ahead of us. First of all, we can revolutionize the way that we address water and air quality in the county, while at the same time changing the way that we view income inequality as we grow a local workforce. We can also, secondly, develop a comprehensive response to the local and national cry for social and criminal justice reform. Finally, we must prioritize the importance of affordable housing with a special emphasis on preparing people to move from renting to home ownership.
Thank you. Now we'll move on to our prepared questions. You each have 1.5 minutes to answer, and the timer will indicate when you have 30 seconds left and then indicate when your time is up. We'll start with the second candidate alphabetically and then rotate the order in which candidates respond to the questions. So for our first question, we'll begin with Jason Stanford. What are your thoughts on the trend of the Florida legislature encroaching on the authority of local lawmakers? And is there anything as county commissioner that you would try to do about it?
All right, well, thank you. Yeah, home rule is something that we struggle with here in Alachua County a lot. Some of that reason is because of our state senator. Some of that reason is because we have a large city in our county and then other small cities in our county that wants to grow. I think home rule is important, and that we need to be really careful in how we talk about who's in charge of what. What works in Hawthorne doesn't work in Newberry. Newberry is a different community in Hawthorne, and both of those communities are different than Gainesville. And so we need to make sure that we are taking everybody's lifestyle and everybody's community norms into account when we create legislation. And we also need to make sure that the people that we elect to go to Tallahassee, both at the Senate and House of Representatives levels, they need to understand what's going on in our community. So when they're making laws in Tallahassee, they're not disproportionately hurting our community. Our community is unique, and so we need to make sure that we highlight our diverse communities here, as well as making sure that we respect them as they want to grow and become their own. I think that it's really important that we cheerlead that for our Tallahassee representatives. Thank you.
Thank you. Kevin Thorpe, your response to the same question?
I agree totally with Jason. Home rule, home rule, home rule. Not only as the thought process for how we approach state government, but how we behave as a local government with the 9 cities and towns that make up Alachua County. There must continue to be clear dialogue between the county commission and local municipalities, so that when we appeal and advocate on the state level, we bring a collected voice and not simply the voice of perhaps the largest city or even the unincorporated area.
And Anna Precia, your answer to the same question, please?
Yes, ma'am, thank you. Well, I agree with my other candidates that we do in fact need to advocate for and protect home rule. I think it is very important that we make decisions here locally that reflect the culture and the diversity of our own county and our own communities. I think that collaboration with our local municipalities to understand the challenges and the issues that they have is important. And I also believe that there are some issues that we need to focus on from a regional perspective. For example, climate action planning doesn't work well if you try to divvy things up and work in tiny bubbles. We need to work collaboratively and look at regional planning in order to make really good decisions to protect ourselves as climate adaptation comes along. Thank you.
Thank you. Our next question will be first answered by Kevin Thorpe. And the question is, what strategies would you propose to manage the anticipated in-state migration from South Florida?
Well, certainly under this current set of circumstances that we're dealing with COVID-19, our approach has to be very measured with all those who enter our community. Unfortunately, we saw what happened in the state of New York, which had a disproportionate effect on people of color, especially those with comorbidities or pre-existing conditions. So while our borders are certainly open, and it's odd to use the term borders in a local sense, but our access to our South Florida neighbors, that access certainly exists. But in this stage particularly, it has to be a very measured approach.
Thank you. Anna Precia, your answer to the same question?
Thank you. Well, I think that we need to focus very strongly on our regional planning efforts. As I said before, I think we need to focus on our comprehensive plan and look at the ways in which we're trying to focus on transit-oriented development and more development of our core of our cities, and focus on infill development that is going to be both climate friendly and allow for some growth in our communities. But I think we also need to be careful that that doesn't come at the expense of disproportionately affecting communities of color and our traditional communities that are in the core of our community. So I believe we need to do that development collaboratively, and we need to be working with those neighborhoods and communities to ensure that we develop smart, but we also develop with culture in mind. Thank you.
Thank you. Jason Stanford, your answer to the same question, please.
Yes, thank you. I was saying earlier, I worked at the CDC, and before I left the CDC in emergency preparedness, I got a chance to look at some projected maps of climate change and how coastlines are going to change. And I think you got to be asleep if you don't know that Florida is ground one for climate change, or ground zero rather. While Alachua County is not a coastal city, or coastal county, we are going to face not only geologic changes, but we are going to face human migration from the south. Kevin's right. We cannot be xenophobic on this. We have to make sure that we are careful on how we let people know that they're welcome here. But we need to look at what Alachua County really is compared to our neighbors to the north, south, east, and west. The people from South Florida are going to want to move here because we have resources. We have infrastructure, we have universities, hospitals, all of it. We need to make sure that we prepare for new people to move here. At the same time, Anna, you are so on this. These people that own land, if we start building bigger houses, bigger complexes, then folks are going to lose their land. Folks that have been here a long time. We can't let that happen. We also can't build on swamps. So we need to make sure that we take careful consideration to where we build our houses and where we make sure that people understand what our communities look like when they move here as they get to know their new neighbors. Thank you.
Thank you. Our next question will first be answered by Anna Precia. The public debate includes discussions about modifying law enforcement budgets to fund a broader range of services and professionals that may be more effective at preventing and reducing the potential for violence in many situations commonly faced by sheriff deputies. What specific suggestions do you have about restructuring county funding?
County funding for our sheriff's office?
It says modifying law enforcement budgets to fund a broader range of services and professionals that may be more effective at preventing and reducing the potential for violence. Okay,
thank you. Well, I would say, first and foremost, I think that we do need to think about demilitarizing our police force. I think in a small community like ours, there's no reason that we need to have armored cars and helicopters flying overhead on a regular basis. But I also think that we need to focus our funding on what I would consider sort of a unified intake center. And I believe Mike alluded to this in his conversations, a space where instead of somebody who's experiencing substance abuse issues or mental health issues being taken to jail, that they have an opportunity to go to a place where they can be evaluated and provided with the kinds of support services and programming that are really needed for them to get better and become good citizens and thriving citizens in our community again, instead of being put into a prison pipeline that would affect their job opportunities and their economic opportunities for the rest of their lives. Thank you.
Thank you. Jason Stanford, your response?
Yes, thank you. Yeah, it's not a crime to have a mental health issue or a substance abuse issue. So we got to stop doing it. We got to stop treating those people that way. We need to make sure that the services that those folks need are readily available when they're in crisis. Having a police officer show up to someone who is having a mental health breakdown or clearly high on substances that are illegal, they don't need to see a police officer right then. They need to see someone. Listen, one of my past lives as a social worker, constantly having to work with folks that are on the fringes to say, you need to make sure that we get you into some housing. We need to get you into mental health care and substance abuse treatment before I can even give you the meds that you need for the disease that you're suffering from. We have got to fund those resources, and they've historically been underfunded. What Meridian is doing with the Alachua County Sheriff's Office is a good thing. It's a long overdue, but it's a good thing. If it works, then let's continue it. If it doesn't work, let's call on all of our leaders locally to say, let's acknowledge that it's not working and move to something that is. But let's look at what's working well and continue funding that. What's not working well is police officers showing up with machine guns to somebody who is having a mental health breakdown. Not acceptable. So we got to look at stopping that kind of mess. Thank you.
Thank you. Kevin Thorpe, would you answer the same question, please?
Thank you for the opportunity. We have to fully fund co-responders. I've had, I guess what I'd call the privilege of sitting with two separate families with law enforcement as we viewed dash cam footage when those families were accusing law enforcement of using excessive force in the arrest of their loved one. That one of the cases in particular involved a family that called law enforcement because they knew their relative was suffering from mental illness. In a sense of co-responders, prior to law enforcement arriving on the scene, there must be an entire cadre of resources and review so that that law enforcement officer is very well aware of the mental history of the person that they're going to be attending to. And the call for service should match the response. People should not lose their loved ones on the side of community streets when the infraction that has been reported initially does not match execution.
That was the 30-second mark. Were you
Yes.
finished with your statement?
Thank you very much. I think I'm finished.
Okay. All right. Sorry, we're getting a little tired, so I apologize. Our last question, almost at the end now, will first be answered by Jason Stanford. About 20% of the county's population is African American, but as of June, represented 51% of the hospitalizations and 63% of the deaths from COVID-19. Please explain why you think this is happening and what, as county commissioner, you would do about it.
Well, I think I have a background in public health, 20 years. I think it's systemic racism. That's why it's happening. I mean, we all know that. African Americans have historically been denied the right to health care. At just about at every level. We have hospitals that are shutting down in rural Georgia because they don't have the funding. There's funding available if we try harder. I believe that we don't have an emergency room on the east side of Alachua County. If you need to go see a doctor, you got to drive to the west side. There's no doctor stop. There's very few doctor's offices. I teach in Hawthorne. If I get sick, I got to drive all the way to West Gainesville to go see the doctor. That's ridiculous. And we have the resources to do this. So I say let's stand up, Alachua County, and demand it, because COVID is real and it is dangerous and it's highly infectious. We have got to make sure that we look out for the least of us. And we know that we have historically stopped African Americans and other people of color from getting into the healthcare system. It's got to stop. And I say that we put resources towards it, real resources, put money towards building community healthcare centers. What happened to Acorn is shameful. Azalea Health is all over our region. Why aren't we working harder to do matching services, matching funds for those grants? We need to open these places up, and we need to have more access to healthcare, because COVID is going to be here for 12 to 18 months, folks, not just a few weeks. Thank you.
Thank you. Kevin Thorpe, would you answer the same question, please?
Certainly an important question, and I wish I really knew where to start. Number one, you have the issue of comorbidity. Then you have the issue of access to healthcare. Then you have the issue of an inherent distrust for certain aspects of the medical profession. It has often been said that when more wealthy communities get a cold, their poorer communities get pneumonia. And this has certainly been the case, not only in Alachua County, but especially in Alachua County, which is of a major concern for us in this setting. So the way that we're going to address this from a long-term perspective, we have devised a number of programs over the years in this county to assist low-income people. What we have not done a good job at is changing the income of people who are struggling with providing for their families on a daily basis. It has always been my position that until we do more in that area, the better that I am employed, the more disposable income that I have, the more likely I am to avail myself of local healthcare services. I can afford gym memberships, and then I have the free time to walk and to exercise. But when you're working on your third or fourth job, the access to healthcare is not the same for people in a different environment.
Thank you. And Apricia, would you like to answer the question, please? I'm sure you would. I'm sorry. Your answer, please.
Yes, ma'am. Thank you. Well, I definitely agree that we need to, or that the cause of this is systemic racism, and that we need to step up and invest in our Black community and communities of color. You know, the reality is that the majority of healthcare doesn't come when someone gets sick, it's before they get sick. It's the social determinants of health, right? It's access to fresh, healthy food, to recreational opportunities, to fresh outdoor parks and ability to get out and move your body, and opportunities to have good health care so that you can do preventative care and you can go see the doctor before you get sick. So I think that we need to invest in not only clinics on the east side of Gainesville and in our rural communities, but also in opportunities for people to have access to fresh, healthy food, recreation, and health care opportunities, not just sick care opportunities. Thank you.
Thank you. Thank you, candidates. This ends our panel.